Hello, and welcome to the West Texas Health IT Regional Extension Center Educational Series. We have two speakers today, Becky Jones and Lita Cross-Gray. They will be speaking about what you need to know about PQRS. All attendees have been muted to block out background noise. If you have questions for our speakers, please post them in the chat block of the GoToWebinar pane. Your questions will be read to the presenters at the end of the presentation. If we are unable to answer your questions during the allotted time, you will receive an answer via email. First, some information about our speakers. Becky Jones is a regional coordinator for the West Texas Health IT Regional Extension Center, working with physicians, practices, and clinics to facilitate EHR adoption and meaningful use. In her time with the REC, Becky has attained ANCC Informatics Nursing Certification and Practice Workflow and Information Management with Design Specialist certification through AHIMA. Becky is a registered nurse and earned her master's in nursing with the TTUHC School of Nursing. Becky has 12 years experience in ambulatory healthcare quality and compliance and is certified in healthcare quality. She has led accreditation and recognition efforts for physician practices through the Joint Commission and NCQA. Lita Cross-Gray is a registered nurse that has been with the West Texas Health IT Regional Extension Center for 2 years, serving rural clinics and providers to reach meaningful use, the White Space Blue Shirt Project, and the White Space Health Information Exchange Stakeholder and Advisory Initiatives. Her education background includes an MSN in Nursing Informatics and Health Information Technology Workforce Program at Midland College. She is certified through AHIMA for Clinical Practitioner Consultant for Health IT and ANCC Board Certified for Nursing Informatics. Lita's clinical experience ranges from neurology, oncology, and home health in multiple staff and leadership roles. Thank you for joining us, and I will now turn over the webinar to Lita and Becky. Ladies, the presentation is yours.
Okay, welcome to the presentation about what you need to know about PQRS. Let me go to the next slide. Maybe a little bit of lag time.
Yes.
Okay. What we're going to talk about is what is PQRS and who is eligible, how to get started reporting quality measures, including how eligibility, choosing measures, and reporting options, and the changes for 2014. Yeah, next. Okay. Of course, PQRS is a broader CMS initiative aimed at advancing quality and efficiency in healthcare and moving towards CMS services based on value rather than volume. In 2015, the program applies a payment adjustment to eligible professionals who do not report quality data measures. And an EP can receive both EHR incentive payment and the PQRS incentives in the same year. So the background of the PQRS is started in 2006 with the Health Tax Relief on Healthcare Act. It's ongoing through quality reporting. It continues to evolve through the Affordable Care Act as of now. So, next. What's new for 2014? There's additions and deletions of quality measures. Reporting requirements for cert period. No participation in 2014 equals a 2% adjustment in 2016. It's alignment with the EHR incentive program. EHR reporting option for group practices. And qualified clinical data registry is an approved entity that collects medical or clinical data for purpose of patient and disease tracking to foster improvement in the quality of care furnished to the patient. Next. We're going to go over how to get started. One, you need to determine if you're eligible to participate, review the measures list and select those that apply to your practice, determine the best reporting option for you or your practice, review the details of how data quality codes are reported for each measure and reporting frequency, and then contact your EHR vendor regarding reporting electronically for the 2014 compliant EHR. Next, please. This is who is eligible to participate under the Medicare Part B. Physicians, podiatrists, speech therapists, physical therapists, audiologists. All these providers are eligible to participate. Okay, and the ones that are not eligible are any provider receiving a payment other than the physician fee schedule. So your federally qualified healthcare centers, your rural healthcare clinics, independent labs or diagnostic testing facilities, ambulatory surgery centers, and hospitals, including critical access hospitals, are not eligible to participate in the PQRS incentive. And then to review and choose measures, when you get these PowerPoints, you'll be able to click on this link and it'll take you right to the measures. There are 9 measures and 3 domains. You have to choose 9 measures and 3 domains based on your patient population. We'll go over that in the next slide. Okay, the 6 domains, you have to choose 3 of these 6. 1, patient and family engagement. 2, patient safety. 3, care coordination. 4, population or public health. 5, efficient use of healthcare resources. 6, clinical process or effectiveness. 9 measures must fall within 3 of these domains. Next slide, please. Then choosing the measures, the frequency that measures must be reported every visit or 1 time a year. It varies per what the measure is that you choose. Types of care typically provided, your practice setting, your quality improvement goals. What are your overall goals for your practice, for your organization? And are there any other reporting being used at the time, like payers or ACOs or other pilot initiatives that you may be involved in? You may be able to align all that together with the same measures. Next page. Here's an example for family practice. The domains are patient safety. A couple of the measures over there you can pick out is documentation of current medications in the medical record and high-risk medication use in elderly. Another domain is public health population, the tobacco use and screening, cessation, depression, BMI screening, and childhood immunizations. The third domain, the clinical process or effectiveness, is like high blood pressure control, cervical cancer screening, or diabetic foot care. Just to give you an example of what a family practice could do. You could choose a measure group such as diabetes measure group or COPD measures group, but the groups must be reported via registry. Now I'll let Becky talk about the registries.
I have listed here 4 reporting options. There's several. One of these divisions is group practice, and under the group practice, there's actually several reporting options. But reporting can still be claim-based. This is the most labor-intensive. You add an additional CPT modifier to the Medicare claim, and it's only on Medicare claims. And when the patient falls within the diagnosis code where the measure would apply. There's registry reporting, either for individuals or measures groups. You must submit on 50% or more of the applicable claims. So that also the registry reporting is based on claims as well. It must be a CMS approved registry. At the end of this presentation, there is a link to CMS approved registries. So there's a charge involved in that, so you will need to check with the registry about that. There is EHR-based or direct reporting from your certified EHR technology. And I'll cover this last because I think this is the preferred method that we need to start to move to. And again, for a group practice, there are a number of options. They can report directly through the EHR or through a registry if there's 2 or more eligible providers. If there's 24 or more, they will need a certified, they can use the group interface or certified survey vendor. And 100 or more EPs, you can use the web interface, but you will also need to report on CHAPS, which is a patient satisfaction survey. So first we will talk a little bit about claims-based reporting. As I said, it is still possible. A lot of people have been reporting on claims, but it's the most labor intensive because it involves adding those additional modifiers on the claims. If there's a full year reporting period, if you have less than 9 measures that apply to the eligible professional, you report between 1 and 8 measures in 1 to 3 domains based on what applies to you, for at least 50% of the Medicare patients. This is subject to the MAV process, which is a measure applicability validation process that was started this year. So especially if you're reporting less than 9 measures, you will have, you can go into the next one, you're likely going to have that reviewed to see if there are any other measures that would apply for your practice. So registry reporting. The same reporting criteria will apply. To choose a measure, the registry, still look at the measures or the measures groups, review a list of the participating registries that are approved by CMS. There is, you can get registry name, contact info, cost information, and which measures a particular registry can report because they may vary. You enter a legal agreement with the registry. 2014 data will be submitted at the end of the year in the first quarter of 2015. If you're using a measure group, and there's more explanation about that explanation if you open the document that explains the measures, you must report via registry. There must be 1 measures group for 20 applicable patients of every eligible professional, so it is a smaller sample size. The majority must be Medicare Part B patients, and this is also for a full reporting year. For the group practice reporting option, it is fairly complex. There's a lot of ways to report, so that's almost another whole presentation in itself. But a group is defined as a practice that uses the same TIN or tax ID number. They agree to have the results publicly posted, and the site you can check out is Physician Compare. They've already started to report data under Physician Compare. Hospital Compare has been out there for quite some time under CMS, and the core measures are reported publicly under Hospital Compare. So we're going that direction for individual providers as well. You must complete registration online. It should have already happened for this. You may have already started this year, but you do have until September 30th of this year to register as a group practice. If you're part of an ACO, you don't need to register separately as a group because that's already happening through the ACO quality reporting. So the group may report by registry if you have 2 or more eligible professionals. EHR, direct reporting. If you are in the first year of meaningful use, you'll need to report the CQMs when you attest to avoid EHR incentive payment adjustment, and that will not count for PQRS. Because we need 12 months in 2014, you have a 90-day reporting period for meaningful use, and you have a 12-month reporting period for PQRS. So even though the measures align, the same measures are used, CQMs are used for meaningful use that are used for PQRS, the time periods don't align. There is web interface reporting for 25 more eligible professionals and CMS certified survey vendors. There's step-by-step instructions about this on this link, and I believe this presentation will be available to you so you can access those links, those documents by links. So let's talk a little bit more about EHR direct reporting. I think this is the direction we need to be heading. With the 2014 certified EHRs, you do have the ability, I'm understanding, to report directly from the EHR. You still need to report 9 measures in 3 domains. If the above measures are not available in your EHR, you report the measures you have data for. So the certified EHR has to have so many measures available to you to become certified, the 2014 compliant version, but they don't have to make every one of the 64 measures available. So you use what you have data for. Talk to your vendor about how to send those reports directly to CMS. You can submit directly, or you may use a data submission vendor. So next slide. To report directly and not through a vendor, you need to register with the Quality Net site. You register using the submitter role. You work with your EHR vendor to create the required reporting files. And again, the 2014 certified version EHRs should have this available. Upload the file through this portal. You will participate in testing. It will recommend that when you submit, and ensure your submission by February 27th of 2015. And there's links below for your registration. Here's what the site looks like. QualityNet, this is where you will go to register and where you will go to submit your quality data directly. This is the same portal that hospitals may use as well. So just another word about the EHR reporting with meaningful use. So you can select the option when you submit for meaningful use to report PQRS with the attestation. For 2014 and beyond, there's 9 measures they require for meaningful use. You're also required to do the 9 measures in the 3 domains. You can either do a course set for the adult population or a course set for the pediatric population. They strongly encourage that, but you don't have to. When you're selecting measures, there's no requirement for the specific measures, but for every practice where it applies, the measure regarding hypertension is strongly encouraged because there's a huge focus on heart disease and stroke prevention nationally. So this is how to report once in 2014. You can't report quality measures with meaningful use, and it also satisfies PQRS, but you can report PQRS in a number of ways, and that will also satisfy the requirements for meaningful use. So again, the CQMs align PQRS measures the same as the quality measures required for meaningful use, but you have the 90-day period for meaningful use for everybody in 2014, and you've got a 12-month reporting period for PQRS. So if you elect when you attest for meaningful use, let's say you attest in the third quarter, and you elect to electronically submit the PQRS data, then you'll have to wait till the end of the year, which will delay your EHR incentive payment. You can select measures to report for the full year for PQRS that satisfies the EHR incentive requirements. If you are part of an ACO, you don't have to report again. That will satisfy both for PQRS and for meaningful use, regardless of the type of ACO. If you are a part of a group reporting under the group reporting option, that will satisfy both, and you don't have to redo for meaningful use. But this is all waiting till the end of the year to do so. So here's a few questions we've had. Can I still report 2013 PQRS data? That deadline is passed, so the answer is no. If I don't have the 2014 compliant certified EHR technology until the middle of 2014, what do I do with that? You report everything that you have data for. You may not have enough to report for an incentive payment, but if you report on at least one measure, you'll avoid penalty. The penalties for PQRS are skip a year. So if you miss 2013, you'll already have the payment adjustments for 2015. If you miss reporting for this year, your penalties will happen in 2016. So back to the adult or pediatric course set. I didn't explain that very well, but it's in the list of measures. Do you have to report on the course sets? No, it's just strongly encouraged. It applies. And again, we recommend everyone report on the NQF 0018. Here's a list of resources, a list of CMS qualified registries that we talked about. If you decide that on the registry option, a full implementation guide and measures list. I didn't mention maintenance of certification program, but for maintenance of certification within the physician's professional organization, PQRS, reporting PQRS measures can be used as part of the quality improvement section required for recertification within your specialty or subspecialty. Okay. So I think we do have a time for a few questions if someone has.
Yes, thank you, Becky and Lita. I have some questions. The first one is, can I use 7 measures in one domain and 1 in each of the other 2 domains to complete the 9?
This is Becky. Yes, there's no requirement about you don't have to divide it evenly between the 3 domains as long as you have one measure in each of those. So yes, it can be weighted differently like that.
Okay, thank you. There's another question. What if we started a new practice in 2014? Can I qualify for the incentive if we were only in business for 6 months?
I think this would work just like it would if you had a new EHR that was addressed in one of the slides before. You report what you can. It may or may not be enough for incentive payment, but it will help you avoid payment adjustments in 2016.
Okay, thank you. And those are the only questions I have. Is there something else that you and Lita want to add?
The other thing we wanted to mention is with this slide is we will help practices with PQRS and how to select measures and how to do the reporting. So if that is a concern or you have more questions, please give us a call.
Yes, thank you for all the participants. Here you can see our phone number and email address if you have any questions. And I just want to thank our speakers for taking the time out of their busy day to share their knowledge with us. If you have any questions for today's presenters, please email West Texas Regional Extension Center using the email shown, and we will make sure you get an answer. Thank you, everyone, for attending, and this is all. Thank you. Goodbye.